Well, hello, everybody, and welcome to Virtua Health's Real Talk Women's Health Chat. I'm Nicole Mahalik from 925 XTU, and once again, absolutely thrilled to be a part of this incredible event for tonight's session. So, here's a few helpful hints for tonight's session. Your camera and microphone are turned off, but you can still ask our panelists questions through the Q&A tab. You can choose to submit questions anonymously, and our experts will answer your question toward the end of the session. A number of you have already submitted excellent questions from our experts when you're registered, and we're going to incorporate many of those into the slide. So just be patient, and you're probably going to see your question, especially if you submitted them in advance. Mental health and maternal health is not a topic that is discussed more importantly, and it should be discussed all the time. So many women are affected by postpartum depression and other mood disorders during and after pregnancy, and we should not be afraid to talk about it. That's what these events are for. Thank you, Virtua. And I'm excited to dive in and start the discussion. And in addition to a panel of experts from Virtua Health, we are so privileged to have a mom just going to share her story with us tonight from her firsthand experience with postpartum depression, Olivia Olive, which so very excited about this. Olivia is 33 years old and works as a casualty claims adjuster. She lives in Mullica Hill, New Jersey, with her husband and three sons, a 3-year-old and twins. Oh my goodness, who are 10 months old. She enjoys yoga and reading. Namaste. We are thrilled that she has graciously agreed to join us tonight and share her mental health journey with us tonight. Thank you so much, Olivia. Jessica Fowler is a licensed clinical social worker and certified perinatal mental health counselor at Virtua's Perinatal Mood and Anxiety Disorder Program. She has 8 years of experience as a therapist, having worked in settings such as programs for older adults, substance abuse disorder treatment, and women's trauma program. Her passion for perinatal mental health grew in 2020 as she began seeing more patients who were postpartum pregnant or struggling with infertility. She started working at Virtua's perinatal mood and anxiety disorder program when it opened in 2024. Jessica lives in South Jersey with her husband, daughter, and their dog. And outside of work, she enjoys spending time with her family and friends, reading, running, and baking. Love baking and reading, not so much running. And Dr. Stacy McCrossin, an OBGYN at Virtuous OBGYN in Swedesboro, has been delivering babies and caring for women since 2006 and has a passion for maternal mental health. She has been named as Philadelphia Magazine top doc for the past 7 years in a row, received multiple recognition, including South Jersey Magazine's Top Docs, Best Docs for Women, and more. She lives in New Jersey with her husband and 3 children. She is a proud organizer of the annual Run with the Docs 5K event, which has raised over $500,000 for Virtua's perinatal bereavement program. I mean, these badass women, shout out to you guys. Oh, it's incredible. And I hear that there is a common thread among all of you. Not only are you all brilliant and geniuses, Olivia has been both a patient of both Jess and Dr. McCrossin. Thank you all so much for being here tonight for this very important discussion. We can't thank you enough. So before we get too far in the conversation, let's start by clarifying the term perinatal mood and anxiety disorder, or PMAD. Most women are familiar with the term postpartum depression, but what are PMADs? Jessica, if you want to kick us off.
Yeah, absolutely. So the term PMAD, perinatal mood and anxiety disorder, kind of came about because just postpartum depression or anxiety didn't really encompass all of the different mental health concerns that moms can experience postpartum. So this term is kind of an umbrella that includes postpartum depression and anxiety, but also postpartum post-traumatic stress disorder, postpartum psychosis, and postpartum OCD. It also uses the term perinatal to kind of cover pregnancy as well as the postpartum periods. It's not just postpartum. Um, they affect approximately 1 in 5 women during or after pregnancy, and about half of those women go undiagnosed. Um, so many people are kind of dismissing their symptoms as normal, or maybe this is just what it feels like to be a mom or to be postpartum.
And so many times people just think postpartum depression. I mean, we're still in a
Mhm.
space here in 2025 that like this is just being talked about a little bit. You know what I mean? And so thank God for experts, thank God for science. Like I'm just so excited that we're doing this. So Olivia, can you share a bit about your experience as a new parent and how you began to notice some of your mental health symptoms and what did the journey look like for you?
Yeah, so I have struggled with anxiety my whole life for the most part. So going into pregnancy, I kind of had an idea that I would be maybe at a higher risk, right? So I already kind of had an idea of what that would feel like. My first pregnancy went amazing. Everything was great. My delivery was perfect. I was like, this is a piece of cake. I got this. And about a week after my first son was born, I started just panicking. Like everything was terrifying. I was afraid for him. I was afraid for me. And I just knew it wasn't normal. My blood pressure was through the roof. I ended up back in the hospital with high blood pressure because of the anxiety. So that first time around, I ended up just going on medication that helped to regulate my mood, and it worked for me that time. Second time around, I already knew what it was. So when I found out I was having twins, I was prepared. I had the conversations with my doctors. And when they were born, I immediately went right back on my medication, knowing that this was going to be, something that I was going to deal with. And same thing happened. I woke up first morning home with the twins and panicked. I felt trapped. I was like, what did I do? What happens? Like just terrifying. And so I was like, I just need to make it till the medication kicks in. A couple weeks go by and I don't feel anxious anymore, but I just feel down, like just dead to the world. I wasn't connecting with my babies. I just kind of thought, it's the baby blues. Like I'm on the medication, like everything's fine. Worked last time. Like maybe I just forget how long it kind of took to get through this. Another couple weeks go by and nothing's improving. And I was having some dangerous thoughts and I knew I needed more help. And I went to my OB. I went back to Dr. McCullen, who's with Virtua, works with Dr. McCrossan, and I told her, what was going on. I said, it's not working this time. I asked for different medication, and she told me about the PMAD program. And I had no idea it existed. And having been in therapy previously, I know how hard it is to find a therapist when you're not sure, what you're looking for. I'd never done postpartum therapy before. And Dr. McCullen, was very reassuring. She set up the appointment for me. It was so, so easy. And Jess is my therapist. We meet online. So it's very easy. She knows I have 3 kids at home. I don't have to go anywhere. So it's just been amazing.
And I think it's remarkable too because you had been to therapy before, you knew you already had anxiety. And so it wasn't like you were like, because I think it's important to know yourself, even if maybe there's somebody on this call who is thinking about having kids, or maybe they're pregnant right now, that they're just like, oh, this must be normal. But you were so, I think what I really love about this and what's going to come across is like knowing yourself and like knowing what isn't normal for you, and that's why we have these amazing experts that are going to say, hey, none of this is normal and you're never supposed to feel like this. And we can help make this better. So you kind of knew already that this isn't how you were supposed to feel, even with your first pregnancy. So by the time you had your second pregnancy, you were like, oh, hell no.
Very
Yeah.
much.
Mhm.
Before we dive into the next one, Dr. McCrossan, I don't know if Jess or Dr. McCrossan could answer this really quick, but I'm just curious. Like, she had twins. Does having multiples or even having a second baby, does that amplify it?
I think primarily for patients, certainly more the history of anxiety,
Right.
depression, pre-pregnancy, and then certainly a history of postpartum depression or anxiety. 100%, as Olivia said, is a little bit of a red flag. It just kind of alerts us like, okay, this may be an issue postpartum. We need to kind of get all of our ducks in a row to make sure that we take good care of this patient throughout the
Mhm.
pregnancy and in the postpartum period. But certainly, I do think that just anecdotally, I think having multiples, going from one to not only two, but one to three, no matter how supportive of a partner you have or family you have, I mean, certainly I'm sure that that can add to those feelings of overwhelm and anxiety. And then a lot of times we kind of dive back into those anxious and depressed feelings for sure.
Yeah, because I was like, me not having any medical experience, I'm like, ooh, does double the babies mean double the stress? Double the anxiety? All right. So as a new mom, even during pregnancy, you're experiencing so many hormonal changes and emotions. It has been difficult to differentiate what exactly is normal. So how do PMADs differ from baby blues? And when should someone start to seek help? Dr. McCrossin, if you want to kind of start with this one.
Oh, sure. So typically, baby blues, a good majority of women are going to experience that after birth. If you think about it, when we're pregnant, our hormones are sky high. And then all of a sudden, we give birth, we're in the hospital, things are okay. And then we come home from the hospital, our hormones have plummeted, and we get home and, we go in the shower and we just start crying, quote, for no reason. Or, we start kind of feeling like a little bit anxious or a little bit sad. I mean, it's a huge adjustment. And, anywhere between 60 and 80% is quoted for the number of women that experience baby blues. Typically, baby blues are going to occur within the first 2 weeks after birth. Again, just secondary to that kind of plunge in our hormones and that adjustment. But if it's something that seems like it's lasting longer than that time, or you start noticing just perhaps feeling unmotivated, things that normally would be pleasurable to you all of a sudden aren't pleasurable, you don't gain enjoyment from things, or you start developing signs or thoughts of self-harm or harm to baby, that's when it's time to reach out. I obviously we want to hear from our patients regardless, even if they're not sure if it's baby blues or more of a PMAD type of issue. But especially if it seems like it's persisting beyond that 2 week window, that's really the key time to reach out to your OB or your midwife or your care provider.
Yeah, and the clarification is so important, but we know that mental health challenges often carry different stigma, especially among women and moms. So,
Mhm.
as Olivia, someone who's been through it, did you experience feelings of guilt or fear of admitting it, or that you needed help?
So interestingly, I think that my situation's a little different because I have the history and I'm very vocal about my struggles. All of my friends know I have anxiety. My whole family knows I have anxiety. What I faced was kind of the opposite, what I may want to call like toxic positivity, which was everybody telling me, you're fine. You're doing so great. Like you're in your head, like you've got this. So in my mind, I was like, oh, I should be fine. I'm fine. People think I'm fine. Like I shouldn't be feeling this way. I should just appreciate how well this is going. If they can see it, I should be able to see it. So I think it goes both ways. It can be a stigma. You don't want to admit that you're having these feelings, but then also you feel the pressure to be okay when people think you're doing okay.
Yeah, and I think too, especially like generations, right? When you think about generations of like
Mhm.
grandmothers and even our moms, that's how they were told to deal with it. Like, you're fine, say a couple Hail Marys, like you're good to go. You know what I mean?
Yeah.
And it's like, well, no, you probably were experiencing this too, and you didn't have the resources. So the fact that we have these resources now, kind of just goes to show that it's important to utilize the resources, So Olivia, at what point were you like, oh no, I'm going to make the call? Like, was it 2 weeks, 3 weeks when you realized, like, no, I'm not fine?
Oh, yeah, it was hard because I think like I kept trying to convince myself that I was okay and I felt like I wasn't. Again, my family knows me, so they're telling me I'm fine. They know how I am. And I think I just kept kind of putting it off, putting it off. I actually didn't seek help until I want to say it was January. My babies were born in June. It was like 6 months.
Right.
I was giving the medication a chance. I was just like thinking this is fine. This is going to go away once they're older, like it's going to be fine. It's the newborn phase. And no, it just was persistent. And I wish that I had listened to my gut sooner, and sought help sooner, because I think I would have had relief sooner. Um, and Jess, I only get to see Jess until they're a year old, and I wish that I had gotten with her sooner because we only had 6 months together. But I think it'll be.
Well, also too, I mean, so many women, I'm assuming new moms, I'm just tired. I'm not eating right. I'm breastfeed. It's all the excuses. And you're like, well, no, you shouldn't feel like hell, So Dr. McCross, on the flip side, how can OBGYNs and healthcare professionals support moms who are struggling with their mental health? Like from a doctor's perspective, like, is there signs that you look for?
Yeah, I think that really the best thing that we can do as OBGYNs, healthcare providers, really is just to be approachable, right? I mean, it's such a difficult subject. People don't like to talk about it. Thank goodness we are of the Oprah generation where we talk about everything these days. But, I almost liken this, and I said this in a previous call, to when somebody has a pregnancy loss, right? Like nobody talks about it. Nobody, until all of a sudden it happens to you and you start talking to your family about it. And it's like, oh yeah, well, this one had a miscarriage, this one had a pregnancy loss. And I find that perinatal mood disorders are very similar. No one wants to talk about it. It's so taboo for some reason. But once a patient has the courage to raise it with their family and their friends, then all of a sudden it's something that people start talking about. Okay, yes, I had a friend with this. And luckily for Liv, just kind of leaning into her gut and kind of saying, all right, no, like everything's not okay. It's time for me to reach out. But I think, as care providers, it's so important for us to be approachable, spend time with patients. You don't want to have your hand on the doorknob when a patient starts asking you, hey, is this normal the way that I'm feeling? We have a screening test that we use on patients throughout pregnancy and every time they come into the office for the first year postpartum that kind of can help trigger us. I kind of have mixed feelings on the screening test because I feel like sometimes I think that it can be a good way for us to identify patients that maybe are fearful to actually vocalize how they're feeling. But then also I feel that sometimes patients can also perhaps not always be entirely truthful about how they're feeling on the sheet, right? Because sometimes they're afraid, like, oh no, if I admit that I'm feeling this way, are they going to take my babies away? Are they, what's going to happen to me? And I completely understand. And I mean, there have been times, even within my own practice, where I've shared with patients that I struggled with postpartum depression with my children. And, I tell patients that because I want them to know that they can tell me anything without any judgment. And, I think the best thing for us is to be, sitting down, not a hand on the doorknob, ready to listen, and really asking patients, so how are you doing? Like, seriously, how are you doing?
Yeah.
And wait and give them a chance to answer.
Yeah, it was interesting. I had a caller a couple months ago, and she was like, "Oh, I'm on my way home from my appointment with my newborn." And I said, "Everything's good." She's good. I'm like, "How are you doing?" And she goes, "Well, thank you for asking that." She's like, "And you know what? I was so happy because she said she first had a male doctor and for her first child, and like he never asked her that. And as soon as she started going to a female doctor, the first thing the doctor does is ask her, 'How are you doing?'" And I'm like, once again, why women should be running the world.
Also, I think, it's quite a change, right? When you're pregnant, the world is so kind to you when you're pregnant. People open doors for you. They let you get in front of them in line at the supermarket. Everyone is so kind to you when you're visibly pregnant, right? And then all of a sudden, once you're postpartum, the attention shifts to the baby. Everybody comes to visit the baby, and who's taking care of mom? Who's looking out for mom? And I mean, admittedly, I think as OBGYNs and female healthcare providers, we just need to be doing a better job to take care of our mothers.
Yeah. Jess, can you take us through various types of interventions that are available? And are there examples or tips that you can share for moments when they're feeling overwhelmed. And also just talk a little bit too about the difference, because I think it's important for people to know the difference between
Mhm.
post-traumatic stress disorder, or obviously depression versus anxiety versus the thoughts. Like
Mhm.
I
Mhm.
had two friends, and ironically, both of them went to Virtua, but one had like hallucinations where like she thought she heard her son crying, she thought he was at the foot of the bed. And I was like,
Yeah.
I said to her, like, I think you need to like call your doctor because that doesn't seem normal. And she just chalked it up to she's not sleeping. And then another friend of mine had way more anxiety than depression, you know?
Yeah. Yeah. It can be tough to distinguish because there are symptoms that kind of overlap and can look like each other. Um, but I know you specifically said like post-traumatic stress disorder, which I think often really gets confused for depression or anxiety.
Yeah.
So there can be like a number of different causes why someone might struggle with post-traumatic stress symptoms after pregnancy or after birth. That could be a history of PTSD earlier or trauma earlier in life that kind of gets reactivated or re-brought up because of all of the different changes and all the changes in your body too that are occurring at that time. Or it can be related to trauma that occurred in pregnancy or in childbirth itself, or even early postpartum. Um, and some of the important things to look for that are kind of a sign that we might be dealing more with like acute stress or post-traumatic stress disorder are intrusive memories about the event that you kind of can't get out of your head and you feel really shaken up for a period of time afterwards. Nightmares, sleep disturbances like insomnia, avoiding things related to, especially with birth, related to labor and delivery, like not wanting to look at photos, not really wanting to look at anything around that. Um, Periods of feeling like you're losing time or just not, you aren't really there, you're not really you, or things aren't real. I'm trying to think if I'm missing anything. Those are kind of some of the most significant ones. Also, difficulty remembering.
Ooh, yeah.
Um, So it's like you can have both memories that are really, really vivid and that you can't get out of your head, and also pieces that feel like they're missing, or you kind of can't put events in an order or a
Right.
sequence and remember what happened.
So how about what interventions are available? What are some of the practices that we can do, like cognitive behavioral therapy, I'm assuming, and there's probably others that you go through in your practice that you could talk a little bit more about.
Sure, absolutely. So, cognitive behavioral therapy is one of the most commonly used types of therapy in perinatal mental health. Helps with identifying your thoughts and beliefs and how those are affecting your behavior and your mood. So, maybe we have certain beliefs about ourselves or who we are as a mother or what our experience means about us. And that can help you kind of examine some of those, let go of shoulds, and kind of think of ways to reframe those thoughts. Dialectical behavior therapy is another form of behavior therapy. It's kind of similar to CBT, but it is more skills based and more about balancing how two conflicting things can be true. So, you had a new baby. This can be the happiest time of your life, and it can also be one of the most difficult or most painful.
Right. Like it doesn't all need to be rainbows and sunshines. Like it's okay to say this is hard, even though it's still the best feeling.
Mm-hmm.
Yeah,
Mm-hmm.
totally. Makes a
Yeah.
lot of sense. Yeah.
And I also really like compassion focused therapy, which is about kind of learning to treat yourself like a friend and someone you care about. And of course, we try to keep things really person centered, especially in the PMAD program. So if there's something you need, we try to kind of tailor that to you, if we can bring in different interventions. And lastly, a thing that I really, really like is bringing in education. So,
Mhm.
what's happening? Why is it happening? And what do we do about it? And I find that giving that information and also really laying out that not only do we know what this is, but we know how to treat it is really, really important.
Yeah, I mean, it's like knowledge is power, right? And it's like when you
Mm-hmm.
know something and you understand that it's happening, it makes you, it sounds kind of funny, but like it makes you feel less crazy in a way where you're like, oh, wait, this is normal. And I always use like the example of how for years and years and years, we were made to think that like having our period is a bad thing, where, you would have this random dude in high school be like, oh, you're in a bad mood because of your period. Yeah, Chad. I have blood gushing from me and I have to use cotton to stop it. Like, are you kidding me? But we were made to think that it's like a bad thing. And it's like, this is crazy when you think what women go through to literally keep humanity surviving. Like, this is what women have to go
Mhm.
through. Like, society would stop. You know what I mean? So, like, the education that this is so normal, and also like I
Mhm.
think it's important for women because women are, we're natural caretakers, right? And so I always say that like there's over 7 billion people in this world and there's only one of us with our own genetic makeup. Like that's so powerful. So of
Mhm.
course you may be going through something a little different than somebody else or somebody else. And so
Right.
the fact that we have all this knowledge and resources and experts like you who can help you through it, it's like don't think that it's better to ask for help and say this doesn't feel right than to suffer, especially when we have
Yeah.
resources.
I always want to acknowledge that, like, it's, it's so easy for us to say, like, it's better to reach out for help. And it can be really, really difficult, especially when you're kind of in the thick of it. You can't quite see yourself clearly or the situation clearly. Like, I struggled significantly with postpartum depression after having my daughter. And even I kind of was like, is this really that bad? Maybe I can figure this out. Like, I do this for a living. And it's not like that.
When did you realize that you had to go for help? And I'm assuming you didn't go to yourself for help, right? Like you went to somebody else.
I mean, daily, but
Yeah. You were looking in the mirror
so
like,
I'd
what?
already had a therapist who I'd
Yeah.
seen for years. What are we doing today?
Yeah. Yeah.
Yeah, so I'd had a therapist that I'd been seeing for years, but it took me a couple of months to like accept that I might need medication too. So it took me until I was about like almost 4 months postpartum before I actually reached out to my OB and asked to start.
Yeah. Olivia, from your experience, what tips and tricks have found most helpful when you're feeling overwhelmed?
So it's funny because everything Jess was just explaining is like what we've done, obviously. And I'm like, yes, yes, this is what helps. And it was that she told me like, this is why you feel this way. This is kind of what's happened in your past, unrelated to your pregnancy, unrelated to the baby. And I think that's important too. Like the feelings don't have to be about the baby. We talked about that, previously. So what Jess kind of helped me do was identify, why I'm feeling the way I'm feeling. That knowledge did empower me, and I could finally like see the thing happening before it was happening. Because the way it kind of, I think, showed in my life was just getting extremely tense and then snapping. Like I would just kind of like and not realize it was happening until I was exploding at my husband or exploding, I hate to admit, at my 3-year-old because, and so what Jess kind of helped me to identify is like, you think you're fine, you think you're fine, you think you're fine, but you are so tense, you're tense, you're tense, you're tense, and then you're exploding, where I was like, I'm exploding for no reason. So I think what the best thing Jess taught me was kind of how to really be aware of your body and how you're feeling. Like just do mental checks with yourself physically and mentally
Mm-hmm.
every couple of minutes, like every half hour. Like you're like, okay, I'm feeling tense. Why am I feeling tense? Like what's going on in my life? And then kind of taking that and using other tools to get out of that mode. So we talked about the PLEASE acronym, which Jess, you can kind of go into that more, but it's like kind of, physical exercise, taking care of yourself, different things like removing myself from the situation, just kind of taking, myself out of the recognizing it when it's happening and removing yourself has been the biggest help for me.
So some of it is I see some on the notes about splashing cold water. What is that basically like when you're feeling so overwhelmed? It kind of is like what you talk about with anxiety in general, where you're supposed to like feel something hot, feel something cold, or like
Mm-hmm.
a lot of times they say eat a sour candy. Is that supposed to like trigger like bringing yourself back down almost?
Yeah, I think the splashing cold water was very helpful previously. I've actually, through kind of talking with Jess, I don't want to say discovered exercise, but I've started exercising, which has been like much more helpful. But splashing water on my face was like just a quick thing to do, just to be like, hey, like
Mm-hmm.
literally cool down. Like you're so tense, like just simmer down. Like this isn't, remove yourself from the situation, break that kind of like where you're at in your head. I don't know how to describe that in better terms, so that you can then approach the situation that you're about to snap on with like a better mental state.
Right. And then also the fact that realizing that they're just babies and
Yeah.
that take a minute. So it's like you do like the splashing of the cold water and like bringing yourself down. And then that helps get you back to a place to be like, oh, they are just babies. Like they're not doing this to intentionally make me mad.
Yeah.
And kind of like resetting. And then also, you know, you're probably not mad, you're probably overwhelmed. So then recognizing it's kind of like just right, like the feelings wheel that's like really big right now, right? Where like you like have to try to recognize
Kinda, yeah.
what you're actually feeling.
Yeah. And a lot of the kind of thought, what kind of works so well about cold, I always try to say for emotions that run hot, use cold. So anger, anxiety, feelings of feeling overstimulated or overwhelmed, because essentially what it does is it does kind of provide a little bit of shock to your system, but it also can help slow your heart rate and breathing because that kind of naturally happens to your body when you're cold.
Yeah.
So it has a little bit of that effect, and it is part of a DBT skill too.
Yeah, it is really interesting the whole concept of like understanding how you're feeling. Because even for me in therapy, like one thing I would always like, I'm annoyed or I'm frustrated. My therapist like, no, like you're angry. Like it's okay to say this person made me angry. Because I always joke that like I'm a lover, not a fighter. Do you know what I mean? And she was just like, but no, like anger is real, so you have to like acknowledge
Yeah.
it. So understanding like how you feel. Sometimes you're not angry though, you are just overwhelmed or you are just tired. And so figuring out what that is really fascinating. So in recent years, there seems to be an increased focus on mental health, especially since the pandemic, obviously, but there's a lot more to grow. So when it comes to maternal mental health resources, which programs are available for women? Dr. McCrossan, if you kind of want to jump off on this.
Sure. I mean, prior to the development of the PMAD program at Virtua, we had identified different therapy practices throughout the area, Cherry Hill, Voorhees, Marlton, wherever. And we would plug our patients in with those programs. And sometimes we were very fortunate. Programs would be able to get patients in very quickly. And other times, a patient would call and say they can't see me for 3 months. And obviously, when you're struggling with postpartum anxiety or depression, we can't wait 3 months.
Yeah.
I mean, certainly there are things that we can do on our end as far as a workup. We'll do typically a lab panel on patients to see if we're able to identify any medical causes for the way that she's feeling. We can certainly discuss starting medications, but I am also such a huge fan of talk therapy. And I just feel so proud that we have this program at Virtua, and really getting our patients into the PMAD program has been effortless. And I appreciate the fact that Virtua is prioritizing women's health and brought this program to our health system, and the fact that they work with insurance. That's the other thing. Like, we would find some therapy practices where they might be able to see a patient right away, but the patient has to pay $120 every time she goes. And when you're out on maternity leave and you're not getting your full salary, and you're buying diapers and maybe formula and all the things, like, who has an extra $120 a week?
And that makes your anxiety and depression worse because you're just so
Yes.
pissed about that.
Yes,
Yeah, it
it
can be hard.
really does. So I think, initially, as healthcare providers, I think number one, sorry, my dog is barking. I think number one, we have to identify, if there are any medical causes. Thyroid disease is particularly Hashimoto's thyroiditis, an inflammatory condition that involves the thyroid that can affect the way a patient feels mentally after giving birth. It's important for us to evaluate for those things, establish whether there's a need for medication, plug the patient in for therapy. And the other thing that oftentimes when I'm concerned that a patient may be high risk for a mood disorder, either during pregnancy or after, is I'll even kind of engage the partner, and I'll say to their spouse or partner, I'll say, listen, like, I know that she's not going to call me, but if you notice that she is not seeming like herself or she's having a really hard time, I want you to call and let me know. And we've been very fortunate that we've had a lot of partners do that.
That's great. Have you ever found
Yeah.
that somebody could suffer with like pregnancy anxiety and then it goes away after they give birth, or vice versa? Like, does pregnancy and post-pregnancy, like, is it similar or could it be drastically different?
I think it depends on the reason for the anxiety, right? Like sometimes we have patients who have experienced pregnancy loss and they're a nervous wreck, understandably so, during their pregnancy. And we have to give them a lot of TLC. We bring them in weekly for appointments, frequent reassurance visits, and their anxiety is very high during pregnancy. But then, perhaps after they give birth, perhaps they feel better, because the baby is here and that worry is gone. But oftentimes I find, and Jess is more of an expert with this, I find that if a patient has that anxiety, even during the prenatal period, even if it relates to a history of pregnancy loss and their anxiety is high because of that, or maybe a previous history of preeclampsia or diabetes, and they're afraid of that happening again, those feelings oftentimes are not just going to go away once the baby comes.
Yeah. Like you were saying.
Yeah.
Yeah. Oftentimes if it's like a focus, especially on health or the baby's health, sometimes that can just shift and kind of change shape after you deliver. So maybe it's focusing on your health. We're no longer worried about some of the things we were in pregnancy, but there might be other things. And same thing with the baby. Like, okay, pregnancy went well, but now you have this entire little vulnerable person outside of you, and what might happen with them. It does increase the risk of having a mental health condition postpartum to have one during pregnancy, especially if it's untreated. It actually reduces the risk of those conditions persisting into the postpartum period if you get treatment during pregnancy, and adequate treatment, like fully treating your symptoms.
So basically, like, if you're feeling it during your pregnancy, to start right away. So then after pregnancy, you could be. Now, Olivia, did you feel any of that? Like, did you feel worse after pregnancy, or were you still feeling anxiety during? But then you suffered from depression. So did you feel any of that before?
I felt great both pregnancies. I think maybe my hormones had something to do with that, but I think it definitely was afterwards. Like after those hormones plummeted, as Dr. McCrossin said, I just was never able to recover. So no, I was actually okay my whole pregnancy, but it is interesting to know. I would like to ask, is the PMAD program available during your pregnancy through Virtua?
Yep.
That's amazing. That's good to know.
Any point in pregnancy and up to a year after the end of pregnancy.
Amazing.
And especially now as they are adding, new providers as well, like that's increasing availability, which is fantastic.
Yeah. So there's the PMAD screening during prenatal and postpartum. Then there's the OBGYN visits. There's the PPD warm line. And is that specific through Virtua, or is that a general line? Just,
I'm not sure about one called specifically that. I know that there is a maternal mental health hotline that's national. And Postpartum Support International also has a helpline, and they also actually have like navigators who can help you locate treatment and resources as well.
Oh, wow. That's amazing. All right, let's get into some questions. So the first one is, what benefits is there, if any, going through the PMAD program if you're already connected with a licensed social worker doing weekly therapy? Is it valuable to have both?
I'm taking it that one's for me. It can be. The answer is kind of, it depends. If you have a therapist you really like and you're really connected with, and you feel like they get it and that's the best thing for you, then it's okay to just stick with that therapist. But if you find, either your therapist is like, you know what, this isn't really my area, and that there's something that's kind of missing or that you're not getting that's really specific to your perinatal mental health, then it can be a good idea to see a specialist too. So it kind of really depends. But one of the most important things about therapy is fit. That you have someone who you trust and feel like you get along with on some level and can relate to. So if you have someone you really fit with, not necessarily, but it can be good to consider.
I agree with Jess. I think the most important thing is, with therapy comes a lot of vulnerability. So the fit is so important because you need to be able to express your emotions and be able to feel vulnerable with a therapist. So if you have somebody that you've already bonded with, that's fantastic. But I think, as Jess said too, if your therapist says, listen, like perinatal's not really my thing, then I think, we move you over to the PMAD program.
Right. How do you stop mom guilt and learn to prioritize yourself at times? I have such a hard time leaving my kids to do something for me.
Ugh, you know what? I have to tell you something. I have 3 kids. They're 21, 17, and 12, and this is something I still struggle with every day. I wish I had the answer.
Yeah.
But I think that sometimes maybe having a frank discussion with your partner, right? And just saying, hey, listen, like I'm gonna need about 30 minutes a day, to work out, or I need time to be able to read, or I need to prioritize this time for me. Self care is not selfish. And I
Mhm.
think that unfortunately, we are in a society that values busyness, right? Like even if you walk by somebody in the hallway at work and you're like, hey, how you doing? And what's the response? Busy. All the time. Everybody's busy and we pride ourselves on that busyness. But one thing that I try to tell patients, and I feel very strongly about this during pregnancy as well as postpartum, is that there is purpose in rest. There is purpose in rest. There is purpose in slowing down. There is purpose in taking time for yourselves. And I think, I still have to remind myself, even as my youngest baby is 12, it is not selfish for me to take time for myself. And in fact, I think, it's very cliche. We all say it, but I feel like it makes us better mothers.
Yeah. Yeah. It's interesting too, as I don't have kids, but as somebody who I have a lot of friends obviously that have kids, but it's interesting how some people, it affects some people so much more than others. Like my sister-in-law,
Mhm.
who has my niece, she's like going here, going there, like, but I think like my brother is such an exception as my dad was, and my mom was always gallivanting too. So I think when you feel safe with your partner, I wonder if that's just me observing, but it seems to me compared to like some of my other friends who have like the extreme mom guilt, they just don't feel as confident in their partner as some of
Mhm.
the other ones do. And I'm like, I kind of like, I don't say anything obviously because that would be
Yeah.
bad. But as an observer, I'm like, I think this probably has to do with like that. And then I think sometimes it's just like how your brain is wired. Some people brains are just wired differently, you know?
Mhm. Yeah.
Yeah. Absolutely. There are those of us who, thrive, like I said, on busyness. And also, too, I think maybe, it kind of harkens back to a little bit of those preconceived notions like, oh, well, my mother never left us, or kind of like
Mm.
these
Mhm.
preset ideas that we have in our head of what motherhood
Yeah.
should look like or should feel like.
Yeah.
Yeah. I think a lot of moms, especially new moms, have like this idea of who they would be as a mom and what they would be like and also how they would feel. And when that doesn't really match up with reality, it often leaves you feeling like there's something wrong with you rather than there's something wrong with that idea of who you were supposed to be and that she's not actually real.
Makes so much sense. Olivia, we're gonna say something. I saw that your green light on.
Uh,
No.
uh, yeah, I just was like, I'm probably just agreeing.
Yeah.
Yeah, because I struggle with mom guilt a lot worse with my first, and I got a lot from my mom saying like, you don't get a break. What do you mean? You had kids. You chose to have kids. Like she said this to me, and I had to like take a step back. I literally said to her, I was like, that's not how it is anymore.
Yeah. Good.
Yeah.
And I said, and I don't like, and I think what you said is very true too, that I kind of put my foot down with my husband and I said, this is how it is. This is how it's going to be. And
Yeah.
I need these things. But I do trust him. So I do think that's important. Like you need to trust the person you're leaving your kids
Mhm.
with. And, hopefully.
That's a whole other panel. If you don't, well,
Exactly.
we're
Yeah.
gonna
It's
have
like, it's
marriage.
hard. It's hard. It's definitely hard. And with my first, I was worse. With my second, maybe it was like a second time mom thing. I was like, this isn't as scary as I thought it was. Or also like, I need a break and I know it now, I know what that feels like. So
Mhm.
yeah.
What are the most overlooked signs of PPD and how long do they last? And also, what is the difference between baby blues and actual PPD?
So some When we think of depression, we often think of like not being able to get out of bed, not being able to do anything, crying all the time, feeling really down or really sad. And PPD can look like that. Like you can have those symptoms, but oftentimes it's what we call like a more agitated depression. So you're probably actually getting a lot done because there's like high pressure and a high need to. So you're probably not laying in bed all day. You're probably actually very productive. And a lot of times, what I say is that postpartum depression doesn't feel like sadness. It feels like failure. It feels like you kind of can't do anything right. Um, so a lot of feelings of guilt, honestly, is really prevalent in postpartum depression. Um, Feeling like you can't do anything right. A lot of self-criticism also tend to be some pretty significant things that we don't necessarily automatically think depression with.
Right. That's yeah. Well, I remember too just reading about it, and like irritability is such a huge topic, and like
Mhm.
people you don't realize that, and I was like, "Oh my God, that makes so much sense." Where you're just kind of, Olivia, you said it earlier, like you're snapping at things that you shouldn't be snapping at, and or like something sets you off so fast, and it's the whole like regulating your emotions thing, which is just like really interesting. Um how can I manage anxiety after having traumatic birth, preeclampsia, and an emergency C-section? This is really interesting too, because, and Dr. McCross, I'm assuming you've seen a lot of this with people that have very traumatic births. We talked a little bit about like the PTSD of the birth. Um, and so, yeah, how can they manage that anxiety? We talked a little bit about it, but maybe if there's anything we missed.
I think really having thoughtful discussions with your care provider, and maybe kind of having the care provider almost, discuss all of the events of the birth with you, right? Like, maybe, what led to the preeclampsia diagnosis, what led to the quote emergency C section, and I feel like when we have a clear understanding of why certain situations arose during a labor course, I feel that that can help us in our healing journey. Now, of course, a lot of times just having this understanding and these discussions with your OB provider is just part of the formula, right? Like I think that a lot of times this is where we do need to pull in our experts in the PMAD program to kind of help the patient, you know, um, handle and treat some of these feelings that she may have. And also I
Mhm.
think we need to recognize too as care providers that when a patient has a traumatic experience like that, um, she is going to carry that into any future, situation, any future doctor's appointment, any future pregnancy and birth. Um, I saw a patient recently in my office, and she was new to me, and we just started talking about her children, and I was asking how old they were, and she started welling up, and I was like, what's going on? And she told me about her first birth and how traumatic it was, and and I thanked her for sharing her story with me. But it just goes to show you, I mean, her first baby was several years old, and the fact that just being back in
Mhm.
an OB/GYN office, and just me talking about it and bringing it up and just asking about the children was such a huge trigger for her, right? And I appreciated the fact that she felt safe enough to discuss that with me and kind of share the particulars of her experience.
Well, I'm assuming both of you have seen this, Jess and Dr. McCrossan, where you give birth and it's very traumatic, but then all of a sudden, like 3 days later, you're sent home with this being, and you're like, well, now keep it alive and change its diaper. And you don't
Yeah.
really have time to process the trauma that you went through as a human.
Mhm.
I tell patients that a lot, especially with my first child, my 21-year-old. At the time, I was an OB/GYN, I was a resident. And, it was a difficult labor and birth experience, as Murphy's Law would prove for any OB provider. But, and I laugh all the time because, and I tell patients, and I've told my colleagues, I'll say, like I do this for a living. And my husband and I, as we were leaving the hospital, both looked at each other like, all right, well, I guess we'll kind of figure it out, right?
Yeah.
And when you're trying your best to figure it out at home, when your vagina's sore and everything hurts and you're bleeding everywhere and your breasts are leaking, and like you're trying to figure out like what's going on with the baby, how to keep this baby alive, how to heal yourself, and then those feelings of like anxiety and overwhelm and depression and just this change in your routine, just
Right.
realizing you can't just run to Target. It's not like it used to be. Things are different now. It's exceedingly overwhelming. But I will discuss with patients often just sharing that feeling. And here I am 21 years later, and I can still imagine how I felt at that moment,
Yeah.
coming home from the hospital with this baby, and my husband and I looking at each other like, I mean, I know I'm an OBGYN, but I
Yeah.
deliver babies. Like,
Yeah.
my pediatric knowledge is maybe a little bit more than the general population, but I'm not a pediatrician, so I have all the same fears, concerns and worries as any of my patients do.
Yeah. You're like, I don't take them home. I just bring them out. Yeah.
Yeah, that's right.
But Olivia, I'm
That's
sure
right.
that you could, one of my really good friends from college, she had twins, and she said that she had this like freak out where she was like, wait, I'm not going to be able to like run into Wawa to get coffee. Like, I can't just put one on my hip. Like, and she said that like she was like stressed about it for like, she goes, this is crazy. I'm used to babysitting where you just take the baby into Wawa and get coffee, but like with twins, you can't. And it's not like a thing. And I was like, oh my God, that's so true. So it's those little moments, I'm sure, that like add to it sometimes.
Yeah. And I say this to all my friends who have kids because they're all like, oh my God, you're super mom. And I'm like, it's not, it's I think every person has their own challenges, right? When I had one, it was a challenge. I was terrified to take him anywhere. I didn't even like, so you're saying she used to take her kid everywhere. I didn't do that with my first. So when the second two came along and I was finally comfortable doing it, I was like, now you can't do it because I have two. So I just think that every experience has its challenges. And I think that's another important thing to recognize that like, whether you have one, whether your birth experience was great, like my birth experience, my first one, perfect. Didn't matter. Like I still like when we were all just talking about when you guys were talking about recovery, I was like triggered because it doesn't matter. Like everybody's experience is different and can be equally validated as a struggle. Doesn't matter like how many kids you have. So
So how long postpartum is it possible for the effects, generalized hormonal, of exhaustion and being not prepared for their child's level of activity? Like, do your hormones regulate? Is this naturally? Do you need medicine? Like, I never thought about this too, but it makes sense. Like, that's a really important question.
Well, again, as a mother of a 21-year-old, I'm still waiting for that hormonal imbalance to happen.
Yeah.
But,
no.
I mean, certainly, as we said, excuse me, it's that drop primarily in our estrogen and progesterone levels after we give birth. And then the problem, well, not problem, but also for women who are breastfeeding, right? Like when we breastfeed, our bodies produce a hormone called prolactin, which stimulates milk letdown and allows us to breastfeed. And when prolactin is high, estrogen is down. So, these hormonal changes can last, for quite some time after we give birth.
Yeah. So again, like the knowledge of like that is a possibility of what could happen sometimes helps settle the anxiety of just being like, well, I guess it depends too. Like some people may be like, "Ah, I'll just see what happens. Other people want to be prepared, but it's also women who have a birth plan, right? And they always, I'm sure Dr. McCross, you see this all the time. And then it goes completely the opposite of their birth plan, and then that maybe causes extra anxiety.
Yeah, for sure. I mean, I love a birth plan. I think even as a physician, my bend is that I kind of like, more of like a natural approach to things. But, sometimes I do get a little bit nervous that, if things kind of deviate from the plan, that might trigger some big feelings, after birth or, even while a patient is in labor. But again, even in the presence of certain expectations for birth or how we might expect birth to go, I really think that this is where, again, like having, a provider that can help kind of, again, constant, clear communication. Okay, I know we said that we were hoping not to do this, but here's the reason why I'm thinking we might need to, consider these interventions. And I think the most important thing for me is that I want patients to feel empowered. I want them to feel that any decision that we've made regarding their care, we've made as a team. If I could never, just go into a patient's room and be like, okay, time to break your water. Like absolutely not.
Right.
Like that's not my approach. And I think that making sure that a patient feels heard, making sure that a patient feels empowered, and making sure that she is a clear partner in what is happening with her body when she's in labor, even if it deviates from her birth plan. I think as long as those criteria are met, we are doing right by the patient. And then at the end of the day, listen, if she ends up developing anxiety, depression, PTSD, I guess from a care provider standpoint, I feel like, okay, we tried to provide as respectful level of care as possible, right? And formed a partnership with a patient instead of, a dictatorship. But I think sometimes, things are going to deviate from the plan or deviate from how somebody thought things were going to go. And I think as long as we maintain that constant communication and connection and partnership, hopefully, that will not add to any of her anxiety or depression postpartum, hopefully.
Yeah. So before we wrap up, we always like to end with one key piece of advice to share. So if there's just one key takeaway for anyone who is struggling with mental health during or after the pregnancy, what would it be, Jess, if you want to kick this off?
Yeah, absolutely. So my biggest is don't wait to reach out for help. I get a lot of like, I'm not sure if it's bad enough, or maybe it'll go away, especially if like you maybe have a day where symptoms kind of remit and you feel a lot better, and then you have days where you don't. Um, if you think something's wrong, it probably is. And even if it isn't, we'd rather you reach out and
Yeah.
we can meet with you. We can assess and talk through things and get you the help you need rather than you fall through the cracks or wait until you're really, really in a bad place.
Olivia, what about you?
I feel like I would have said the same thing, but I also think it's important to have like a good network of friends, family, your partner, include them if you feel comfortable doing that. I think it's so important to talk to other moms, be honest about what you're experiencing. And like Dr. McCrossan said, like you'll be surprised who else has been through it, who can then give you advice like, hey, I felt like that. I literally did this with my friend. She had a traumatic birth experience. I immediately was like, this is what happened to me. I did this program. You should do this program. So it's like, I think just being open and honest with your network so that you can kind of feed off of each other, learn what's normal, what's not normal, and get the resources you need through your connections.
And I would assume too, unfortunately, there are people in situations, maybe they're single moms, or, maybe they don't have a super supportive partner or family. It's like there is professionals, whether it's your OB or it's a program, it's a therapist. So don't feel defeated if, God forbid, you don't have that support. There's always somebody and multiple people that are willing to support you. Because I'm sure you've come across that, Jess and Dr. McCrossan, where I think about single moms, right? I think about people
Oh, yeah.
who,
Mm-hmm.
maybe they for whatever that is. And I think it's important. I'm sure there's a lot of women whose partners suck, unfortunately, So the fact that there is programs like Virtua is amazing. Dr. McCrossan, what about you? What is a piece of advice?
Um, I think from my end, and I would definitely echo what both Jess and Liv said. But I think again, listen to your gut. Nobody knows your body better than you do. And if you ask for help and you feel like you're not being heard, ask again or ask to see a different provider in the practice, if you feel like your concerns are not being met. And also just remembering that, as I said earlier, self-care is not selfish. Take the time, get your nails done. It takes less than an hour. Everything is going to be fine at home. Prioritize self care.
Absolutely. Once again, thank you so much. You are all
Yeah.
so amazing. I mean, talk about a trifecta of wonderfulness here. We're very lucky. Thank you Virtua.
staff, including me with these two, is very flattering. Thank you.
Well, a lot of times, but it's so important because a lot of times we do these
Mhm.
and you have the experts. I mean, this is what's wonderful about Virtua, but having somebody who's actually went through, I mean, obviously Jess talked about it and you're all three of you are moms. But it's been, it's very fresh and you use the program. So thank you for sharing that. That's amazing.
Thank you
And
for having me.
these situations are so common, but so many people feel alone. They feel on this island, and it's like, having these this support with the whole professional aspect of it, literally is going to help save lives. That's not dramatic, it really is. So
Mhm.
a recording of this session will be emailed to you in the next week, which is awesome. For more information about perinatal mood and anxiety disorders, or to take a risk assessment for postpartum depression, just visit virtua.org/postpartum depression. As you can see, it's on the screen. Thank you so much for joining us. Thank you, Dr. McCrossin, Jessica, and especially to you, Olivia, for sharing your story and your expertise and all of your knowledge and compassion. Can't thank you guys enough, and have a wonderful rest of your week. And thank you again for Virtua for putting this together. I'm always so honored, and everybody have a great rest of your week. Thank you so much.
Okay.